Okay, we've got a room full of people. I think a few others trickling in, but we will jump in and get started. So thank you, everybody, whether you are enjoying the tail end of your cup of coffee on the West Coast, having a lunch break on the East Coast, or somewhere in between. Really appreciate you joining for the session today. So I know a lot of people here are very accustomed to joining these webinars. We have now done, I think, over a dozen of these. So for first timers and first comers, there is an insights section of our website, clarityssi.com, where you can go back, find a lot of the content that we've done around driving engagement through correspondence. We've touched on everything from star ratings to member guides to EOBs to annual planning and a number of other topics. So if this is your first one, we're going to touch on some of that content just as sort of a place setting. But if anybody does want to get more of kind of where our journey has been over the past few years with that, know that you can always access our content on our website. Today, though, we are going to be doing a little bit of a deeper dive on a specific type of documentation that our clients work with us on every day and at a few key times during the year. And those are a little bit different than when we think about ID cards and letters. We also know that a huge footprint that's going out to membership involves regulatory or regulated correspondence. And so we're going to take a look at how we can look at this, how we can leverage this big body of work and still drive engagement through it. So that's where we're headed today. Just for introduction, again, I've done a lot of these webinars and then looking at the attendee list, appreciate so many of the folks that I've seen kind of month to month in the past few years over these. For those who are, again, first timers though, my name is Drew Corbett. I'm on the product innovation team here at Clarity. And I've really spent my career in healthcare strategy and a big swath of that directly in member engagement. So serving the payer industry in terms of driving strategies and implementing and optimizing platforms that help bring members closer to their own state of well-being, their own benefits designs, and improving their care journey by way of actually engaging in the benefits that they have access to. So that's sort of the lens that I've joined Clarity just about 3 years ago now. We've been putting a lot of work into how can we really fundamentally look at everything that we produce for the market, whether that be an EOB, whether that be like we're going to talk about today, a 1095, or an ID card, a letter, etc., and fundamentally change our expectation of what those assets do for us. When I put my marketing hat on, I'm all about touch points, right? And so if we're thinking the more times I can be present and visible and deliver a message to a member, the more likelihood I've got to get that member to engage in behavior that's going to be both cost and health improvement for them. Through that lens, I look at the touch points that Clarity has and say every single one of our pieces of paper leaving our print facility is an engagement opportunity. And so why does that really matter? Well, we know engagement is sort of the big topic and really has been in healthcare for the last 10 years or so, especially in the payer market. I had a team member actually send me an article this morning citing Karen Lynch, for those that don't know that name, the CEO of CVS Health. Her quote in a recent symposium was, "We're thinking about how do we engage people that are now using technology in various ways." I mean, that's like the headline of a CEO of a PBM and now joined with Aetna, but as CVS Health, really looking at this engagement component as the critical metric of how we're improving kind of the healthcare cost equation. So as we all come to this table, it's a great opportunity for us to say, in the work that I'm doing, the correspondence that I'm presenting out to members, do I have the opportunity to create my little piece of the world as more engaging to them? And that's really where Clarity has found a nice opportunity to partner with our clients. When I've done email strategy work with health plans in the past, we sometimes have really great uptake on emails that are driving engagement, but the plan will then say, but we've only got about somewhere between 5 and 10% of really good solid email addresses. So while the efficacy is there and the penetration is there, it's just such a small slice of the overall pie. And as a supplement to that, it's why the print collateral can be such a potent weapon in sort of our artillery of how we're approaching engagement to try and reach everybody, is that with almost 100% fidelity, we're going to have a mailing address of a member, because that's how they're getting that ID card, that critical correspondence. And so we know that while this is going to have a different uptake than some other modalities like text or like email may have, we've got the opportunity to really blanket everybody. So for again, those that are maybe just joining one of these webinars for the first time, and to be candid, whether you're a Clarity client or you do your print correspondence through someone else, we're really making the pitch that the expectation of an envelope going in the mail should do more than simply reach the mailbox. It should be something that helps a health plan in their broader strategic objectives. And it should also be something that provides you back with compelling data to help you learn about your market. So that's a little bit about the why are we even assembled and discussing this, and where is Clarity sort of placed at the table, and we'll of course get into more detail on that. So if you sort of remember three things, key takeaways here. One, regulatory documents, and we'll get into exactly what I mean when I categorize that, they have more engagement potential than we give them credit for. They are, in some instances, very well aligned with health plans' broader mission to personalize member experience and just improve overall member satisfaction, which we know has some long tail financial benefits as we get into things like CAP surveys and things like that. And it's not as hard as I think many people perceive to start turning these into something that's fundamentally more valuable than simply 8.5 by 11 in an envelope. So those are the three places that we're going to dive a little bit deeper into, but that's the takeaway of what we really want everyone to sort of sink in with today. So our team put together a hypothetical scenario, and this is, as we're saying, based on true events. But let's just look at a footprint with a fictitious Clarity client, and what is the full suite of services that we might provide to, you know, not a national plan, but a nice kind of mid-sized regional plan. And so you're seeing that we've got a bunch of letter distribution. We're doing a lot of ID cards in a given calendar year, member guides, and so on. And so we sort of end up with, you know, somewhere shy of 1 million touch points with this sample health plan. When I sort of peel the onion back and look at that same data, and we just look at those documents that I'm going to call, for purposes of today's discussion, those regulated documents. So ANOCs 1095s, summary of benefits coverage, and EOBs. We might be looking at about 212, you know, the round numbers here, 212,000 of those are in that sort of like regulatory arena. And when I think of that as a total distribution, we actually have a pretty big opportunity that I think would be a shame to totally drive by and say, we're just not going to be able to sort of influence or encourage or engage a member by way of these. 200,000 opportunities to be in front of a member is a lot. And so I think that the really judicious route is to say, what can I do with those so that I'm advancing the ball, at least in some incremental way, and nothing is going out without a fighting chance of getting a member over that line of whatever a priority might be for him or her. If that's register for a portal, download an app, or, as we'll share and get into, maybe there's a chronic condition or an opportunity to get involved in something like a mail order program. So really big volume that can help to drive towards this if we choose to sort of put the thinking cap on and get creative on how these become engagement documents. And here's kind of the comparison. So just if a health plan felt compelled to say, you know, we believe in direct mail, that has a place at the table. It's not the only strategy, but it's got a place at the table. And so we're going to try and get a direct marketing campaign out there to drive people to take an action. whatever that action may be. We did some just kind of back of the napkin. So if you've got, 50 cents per piece on the package, on the postage, you take some time to create a really cool one pager. And so you've got some content design, and then, a bunch of admin and overhead of getting approvals and doing iterations. Not hard to think about reaching 200,000 members and spending close to $250,000 on a DM campaign. And I think that's really the alternative that we're proposing here is looking at that same 200,000 plus pieces of correspondence. We've got the ability to include some type of messaging in a light way that doesn't have any added cost. And so this is not to say that where we're going to go on some of the examples I'll share are apples to apples with a designed direct mail piece. But if we're thinking about squeezing value, as we know there are cost pressures across every organization, this is a place that really feels nice to say, look, we got a little bit of a win here, and there wasn't a big administrative cost to us or really any cost above what we already were compelled to spend. So keep that in mind. Again, all these numbers and the example here is simply that. It's an example and kind of a thought exercise that helps us understand we don't want to leave anything on the table when it comes to driving these engagement metrics. So let's get a little more specific here on this. These are just blinded, but some of the key documents that we're talking about. We've got things that can, in some cases, be pretty specifically IRS regulated and or even IRS provided in terms of a form like a 1095. And then things that really aren't fundamentally intended to be engaging. These are much more sort of documentation for reference sake and for the security of the member's sake. And so it's easy to fly by them and kind of like assume there is no opportunity for elevated engagement within these. And to be totally clear on this, the elephant in the room is we are not talking about putting something on the 1095 document itself. So the regulatory compliance of this is absolutely tantamount to making sure that we're doing everything between the lines. And when we send out something like a 1095 or an ANOC, those actual artifacts remain completely untouched. So where is it then that we have the opportunity to drive a little bit more of that engagement? To me, this is the total Trojan horse of these packages. Let your address sheet do the talking. And I think there are a lot of places where we sort of look at this as an assumed dead white space. And if we just shift our perspective a little bit and say, let's actually leverage that white space just on an address sheet, we suddenly have the opportunity to capitalize on, in our example, a couple 100,000 kits that might go out to the membership to drive them in that positive direction. Now, it might sound like not that many, or we may say, well, I don't know what the uptake is going to be. If you're doing it anyway, and you get another 10 or 15,000 people to perform an action, it's an amazing amount of value that we can get by just inserting this concept and ensuring that everything we do goes through that engagement lens in our mind. Over a year, 2 years, 5 years, we're now starting to distance ourselves from competition that is underutilizing this modality to drive some of its engagement goals. So I know that there are different sheets of these for different markets or different lines of business. Those address sheets might perform a little bit differently, but the idea that we're really trying to instill is nothing should go out if we haven't given it the rigor of, is it performing for me? Is it driving the organizational metric of portal registrations, of diabetes prevention program signups, whatever that might be? We hate to fly by and leave any money on the table here. Now, some of the actual methods that we include now that we've kind of flipped the switch on looking at this real estate as leverageable, for folks, again, that have heard us speak to EOBs, heard us speak to member guides, to letters and cards, a lot of the same principles that we really promote are going to be in this same space as well. So the tenets of member engagement, especially in the print modality, are we are not trying to waste people's time. It's how quickly can we make a compelling statement, and then how easy and seamless and frictionless can we be in terms of letting them take the step associated with that request. And that's when we start to get some really interesting tactics that we can play with. And if we're really sort of taking this to its endpoint, that you could test and learn from. So we've got an example here where we're looking at, we're emphasizing value, both in the sense of health and in the sense of the member's finances. So we've got that free annual wellness visit. And then we've got a QR code, which we've seen as be effective, whether we're talking about commercial or Medicaid or Medicare lines of business, in terms of there are people who are more likely to take that action by scanning that code as opposed to finding time to get to a web browser on their phone or getting to a computer. So we're leveraging those same tactics that we know are conducive to, across a population of thousands of people, getting a higher percentage of lift. Same principles, just a little bit of a smaller container here within this address sheet. Just another example to sort of demonstrate this. But some of the other tactics that we've used in particular as we get into different age and gender cohorts, and we'll touch more on this in a minute, but education is a huge opportunity to close gaps there. We also know that that has the opportunity to sort of stave off some of that call center traffic, which is a big cost priority for a lot of the plans that we work with. But introducing this idea of urgency, we've had a lot of work where clients have asked us, should we demonstrate urgency or should we demonstrate there's really high value associated with the action we want people to take? It kind of depends. Different audiences are going to respond differently to these things. In this case, you're seeing something more like register today, or here at the bottom of this page, you're seeing get back on track, schedule that appointment. You might be falling behind just a little bit. That kind of soft language can have an outsized value in terms of the uptake, depending on who we're sending it to. But that's all really interesting data to get back and realize and learn what's worked and what hasn't. Just a couple of other layers of this is we can do, thinking relative to a calendar and thinking relative to where the member psyche is. This is a really nice opportunity just for some of those tap on the shoulder things. The preventive screenings, if people are at, say, a certain age band, those flu shots, if everything we sent out from September to January in terms of those regulated docs had a reminder about flu shots until one was completed, then you might see that overall uptick. But it is just that nice little whisper in the ear of, I'm gonna collide with this information as a member. It's going to be forefront of mind. Now, especially for members that are getting a lot of correspondence from us, and that might fall into even like polychronics, for example, then we've got the opportunity to get that message in front of them even more frequently. So one thing we've learned in doing this for a couple of years is sometimes less is more. And that's both to the appetite of our clients and where their brand might be in terms of, a more conservative look and feel. And really that tenet of I've got a business relationship with my member and they expect a business relationship with me is different than something that is really sort of consumer-centric brand forward. Our perspective is that there's not a right way to do that. It's really about knowing your membership. But in the instance of maybe a brand that's a little bit more muted and a little bit more business, you can still have that opportunity here. And even if you're just doing something dry, like, this is a call to action for We've Gone Paperless, sign up for paperless preferences. You can do so in a way that sort of respects those sensibilities of your membership if they like that slightly more muted and downtoned as opposed to more of kind of a marketing feel. So it really becomes your canvas. And as you know your memberships, or as you're talking to one line of business versus another, you might find that, pick the right tool for the right job. And sometimes those earlier examples might be a better fit. Sometimes something like this might be. Clarity has really spent a lot of time getting to know the behavioral principles and behavioral economics associated with typically, consumer work. And when you walk through a supermarket and you're going to see two different boxes for a Coca-Cola product, and they're going to have a slightly different marketing language on them. And of course, we know why that is, because somebody might respond really well to the way one thing is framed, whereas somebody else might respond really well to peer pressure. Those are the kinds of things that if we're not including those in our language to members, and even to take it further, if we're not measuring and understanding our insights based on dropping these out there and seeing what people respond to, we've really got a lot of value left to gain. And we've run some of these experiments, whether they're on just address sheets or whether it's a full-blown ID card kit, where we're going to put up an example that has effectively the same language, but is using authority, like this one right in the middle, and then an alternative version where we're using some peer pressure. And we can look at the actual difference that we're seeing based on if we sent those out to a population, which one better performs. So the exact same principles that we're taking in terms of behavioral economics and behavioral science, it's going to apply to a member no matter how they read the message. But including it is important because it gives us an edge up on making sure that we're more resonant with those members, which we know over time as the long-term goal of reduced attrition and greater engagement. So all of these things, I think it's the difference between looking at those examples I shared and saying, is this really just a graphic design effort, or are we actually digging deeper beneath the surface and we're testing and learning from different behavioral methodologies that we've included? So all of these are ones that we're sort of getting pretty fluent in, including them and sharing different versions with teams so that they can make a decision based on what feels best. But it is the underlying DNA of what's in the messaging that we provide. Kind of a fundamentally different regulated document, especially as we think about the Medicare space, is with regard to the explanation of benefits. And I'll say at the top here that we've had enough discussions with plans around doing things to drive engagement through EOBs that we know there is a spectrum of interpretation on how much those can include messaging like the ones I'm talking about today. So for plans that have a more conservative approach to what's included in those EOBs, that is 100% fine. And of course, completely, within the plan's jurisdiction to say what should go on things and what shouldn't. But we do have other plans that are starting to say the EOBs have such high potential to drive some of the engaging action that inclusions on things like the address sheet might start to become appropriate. So I think if any of us are looking at an EOB that we've recently received in the mail, assuming it's sort of that traditional look, I'm going to use a Tom Brady example here. So Tom Brady at the 2000 NFL Scouting Combine is probably about the most underwhelming person on the field. And we've sort of made the internal joke of likening this to our EOBs, where we don't have a traditional expectation of these being really high performers. But what we've started to see is that if we're including the right messaging that is pertinent to the content of that EOB, and I'll give you an example in just a minute here, this can totally become the superstar for your engagement. And the reasons are a fewfold. One is that these can be the relationship between the volume of EOBs going to a particular member and the cost of that member are pretty well correlated. So someone who has a chronic condition and is often going in to see a physician, lean on those benefits, they're going to have a higher volume of EOBs. And so we know the marketing opportunity is commensurate with the cost of care. opportunity. And that gives us that chance to say we're really present with the person we need to be really present with. From there, we also have kind of the highest value opportunity. And if I think about the sort of how we architect that, one of the key pieces of data in the explanation of benefits is looking at the codes associated with that member's visit. And if we look at those codes and say, you know, this is a code for an A1C test, and so we know that we've got a diabetic here, it can be a really appropriate place to say, there is an available program sitting there within your portal or ready to be downloaded on your app. It just needs your sign in, and you now have this benefit working in your favor. So that timeliness, that recency, and that relevance to a more clinical and or a more costly condition can be exactly the territory where someone is most likely to engage in that behavior change. So the promotion of one of the programs that either might be a point solution that your plan has invested in, or maybe it's an internally homegrown program. It might even be something like a nurse navigator line. Any of these are opportunities to say, we know and are there for you with what has just happened in your medical journey. And not only do we want to dictate that information to you for your records in the form of the EOB content, but while you're on this journey, we also know that there are programs that we've invested in that might be available and useful to you. That type of an environment is where we're going to get the most bang for our buck. And kind of looping back to the beginning of this whole story, you know, if we even got a few dozen or a couple hundred or 1,000 people involved in a chronic condition management program because we were the right message at the right time, that can have a benefit of hundreds of thousands of dollars back to the plan. And again, just for sort of optimizing the opportunity that's always been right in front of us. So, you know, today is pretty quick on that. We wanted to share, especially as, you know, a lot of people are coming right out of 1095 season. A lot of people are also putting on the hats of the upcoming ANOC season. We just thought this would be a good time to share that, you know, this is really low-hanging fruit. One of the things that we always like to do at the end of our webinars is help to catalyze the conversation inside of the organization you're at. We know that in some cases, this is a little bit of a leap from how correspondence has traditionally been run and managed, but we want to help with that. So our offer is standing and always here to say, if you want to see what some of these mock-ups look like with your logo, maybe a call to action, maybe a partner program that you're really invested in pushing and promoting adoption to, happy to dress those up for you. And myself and our account teams are more than happy to walk through some of the learnings that we've seen along the way with that. So that is it for our content today. I don't know, Kaylin, I think we have a chat open for questions. If any came through, I'm more than happy to field them.
Thanks, Drew. Yes. Just a reminder to everyone, please submit any questions you have in the Q&A area on the Zoom control panel. We have a few that have come in. This first question asks, is this in conflict with periods when we are not marketing to members?
Okay, so I think the premise of this is CMS has windows of the year where I believe it's overlapping with when CAP surveys are sent out. And so for folks that aren't in that world, you know, the CAP surveys are effectively member satisfaction surveys. And so that's a period where CMS wants to make sure we're not, you know, overly inflating the sense of, you know, how a plan is performed or not. Our perspective on this is presenting the availability of an existing benefit is not marketing to a member either to respond to something on a survey, nor is it trying to sell them something or have them, you know, purchase anything. So again, if this is something that doesn't feel right based on the interpretation of your plan, that's completely fine. I think the diligence here is to ask the question. because it's a real engagement opportunity that's there. If your plan sort of pursues that as a strategy, we've seen it be really successful. And we also are not, I mean, Clarity is not in the business of like being way out on the risk side of things like this. So we feel really comfortable with this, but of course it's got to be to your own culture.
That makes sense.
Yeah, good question.
This next question says, some of our materials we send are actually utilizing the existing back cover as the address sheet. Is this still possible for us to take advantage of?
Okay, so if in the printing world, maybe we have, I don't know if it'd be an even or odd number of sheets, but in some cases you might have the address as actually part of the document itself. Good for diligence. I think that's probably a case by case basis. I think our recommendation again would just be ask the question. If I'll go back to the 72 million. In this case, it's ID cards that we distribute, or you could look at the 200,000 or so sample correspondence that are in that regulatory arena. If we're at least asking the question every time something hits the member and really putting that marketer's hat on of, I want to engage people, my de facto is going to be, this is an opportunity until proven otherwise. I promise you, at the end of 1 year, 3 years, 5 years, you will be so far ahead of where you are. So on that back of the document question, there may be instances where this isn't a fit. But I think the yield of just trying for these, you're going to end up with more yeses than nos. Fair question though. It's not always a yes.